how should providers try to mitigate that when they're using AI tools? What can they do to be sure that the tools that they're using, either they can either recognize the bias or be sure that the bias has been minimized? What should a provider do relative to these AI tools that are really popping out in the market these days?
Yeah, I think for myself, there are a few things that I do. First and foremost, right, I look at who's developing the tool. I want to understand whether there are any clinicians involved. And a step above that, whether they're licensed clinicians. I think for myself, that matters because I'm a licensed psychologist, right? And I have a clear understanding of the kinds of federal, or not federal, right, but our national and our state level ethics, the ways that we had to demonstrate that in tests, but then in addition to that, our continuing education, right? And so the reason I say it is because it's deeply embedded in us to really consider patient safety always, right? To do good and do no harm. Like those are the first two as aspirational, right? Key themes that we think about in ethics for psychologists. And so similarly, if you have clinicians involved in the development of tools, then they are led by those values, and that matters a lot. But I think there are other things that are important too, right? It's not just who is part of the team, but it's also terms that we use in some AI model development around transparency and explainability. But those terms are really similar across the way that we do clinical science in general, right? But I think for a long time, AI was not necessarily being built by clinicians, or clinicians really saw it as something that wasn't necessarily germane to the work that they do. And so I think that we have kind of this like artificial like schism between like clinicians and like AI developers. But I'll say that I love working at a company where several of us are clinical researchers, right? And so that we approach tools, tool development, not just with like, is this going to work for what the customer needs, but also, are we doing good in the world, right? Are we building things that are going to help patients keep them safe, but also help them get the kinds of services that they need and help clinicians to perform better?